I am Jessica Goodrow. I am a member of the marketing team here at the Spina Bifida Association. And here with us today is Timothy Brei, who's also with the Spina Bifida Association. Tim, would you like to introduce yourself?
Sure. Good afternoon. I guess it's afternoon everywhere. It just turned afternoon here. I'm Tim Brei. I'm the medical director of the Spina Bifida Association. I've been the medical director for a while. In my day job, I am a developmental pediatrician at Seattle Children's Hospital, and am also an aging adult with spina bifida. So.
Perfect. Thank you so much, Tim, and thank you for joining us today. And also with us is Evelyn Twentyman from the CDC. Would you like to introduce yourself?
Absolutely. Good afternoon, and thank you so much for having me. I'm Evelyn Twentyman. I currently serve as Chief Medical Officer for the Vaccine Coordination Unit inside the National Centers for Immunization and Respiratory Disease, inside the Centers for Disease Control and Prevention. It is an absolute pleasure to be here. The other hats I wear include serving as a boarded physician in internal medicine, particularly with a nearby refugee health clinic that's very close to my heart. And I did want to mention my connection to spina bifida. My best friend in grade school had spina bifida, and I am sad to say she is no longer with us today, but her memory has certainly served as a blessing for me for the remainder of my life. And I am just so thrilled to be able to do anything to help the Spina Bifida Association in her honor. So thanks so much for having me here.
Thank you so much for joining us, and I value that connection so much. And today we're actually going to be talking about COVID-19 and the vaccine and how that relates to spina bifida specifically. There's a lot of really important, exciting news that's coming from the CDC. We've done a lot of studies on our end from the Spina Bifida Association. So we're here to chat a little bit about that. But this conversation is really here for you all who are tuning in. This is a live question and answer session. So if you have any questions, please just put them right in the chat on your screen, and we'll take some time towards the end to go through those questions. Like I said, they're for you. So ask anything you have, and we'll get back to you the best way that we possibly can. And Evelyn, you have a couple slides here up for us. Lovely.
I do indeed. Should I just run through a bit of a background to COVID-19 vaccines and where we are right now?
Yeah.
Okay, wonderful. Well, thanks again for having me, and feel free to interrupt me anytime with questions. And also, I hope we'll have lots of time at the end for questions. What I thought I would open with is just the current state of COVID-19 disease in the US, including both cases in general and deaths, what we know about the relationship between COVID-19 vaccination and COVID-19 deaths, and then talk about the extensive experience that we have been fortunate to build up inside the United States when it comes to several COVID-19 vaccines. So I'm going to be reviewing how many people have had a dose of a COVID-19 vaccine, what products those have actually been, so that you can see what our experience is with each of these products. I'm going to talk about the ways that we closely monitor COVID-19 vaccine safety. I'll say it now as a bit of a preview, but COVID-19 vaccines have undergone the most intensive safety monitoring in United States history. And so you'll see some of the arms of safety monitoring that are included in that and that have brought us to this point. And so following that discussion of vaccine safety, I'll then be moving to a discussion of vaccine efficacy and how we know that these vaccines work and in fact continue to work in the Omicron era, which is really exciting. And then following that, I will be walking through our current vaccine recommendations. In other words, who should be getting what vaccine and when, what does that look like? And throughout the presentation, I'll be including links to where you can learn more about anything that I'm saying. And then I also have 2 different points that I'm going to use to reach out for your help if you're listening, ways in which you can help advance the fight for COVID-19 vaccines and advance the fight against COVID-19 disease. So let's get started. So first, let's take a moment to mention what the burden of COVID-19 cases has been in the United States. I am always somewhat stunned to say that we have experienced more than 85 million cases, 85 million distinct cases in the US since this pandemic began. Currently, our 7-day moving average of cases is just over 100,000. So from this, we know that the threat of COVID-19 is definitely not over. Furthermore, tragically, deaths from COVID-19 are not over either. What you're seeing here on this graph is daily trends in the number of COVID-19 deaths. In other words, that's per day in the United States. And you'll see that this is measured. We started capturing this on January 22nd of 2020. And this takes us through June 10th, 2022. And we have, as of that day, accumulated more than 1,006,000 deaths. Right now, I'm sorry to say we are at a 7-day moving average of 298 deaths per day. So not only is the fight against COVID-19 not over, COVID-19 continues to tragically end the lives of people across the US. And to save time for questions, I didn't do a whole age breakdown here, but I will mention our newest group eligible for the COVID-19 vaccine later in this presentation, and that is kiddos ages 6 months through 4 years. And even that young age group has tragically experienced deaths over the course of this pandemic. And so I just think it's important to say COVID-19 is still here. COVID-19 continues to kill our loved ones of all ages. Now let's transition to starting to talk about vaccine and what does the vaccine have to do with any of this. So I wanted to put up a graph that was released last week on cdc.gov. You can go and find it at this little address that you see running along the bottom if you'd like to see it. And you can even follow that if you'd like to keep seeing this updated. This chart that you're looking at now is updated about once per month. And this compares rates of COVID-19 deaths by vaccination status in people over the age of 5 years old in the US from April 4th of 2021 through April 2nd of 2022. That's the newest data that we have available as of today. And this compares, you'll see unvaccinated folks in the black line compared with those who are vaccinated with at least a primary series. And so you see that folks that were unvaccinated have had a quite significantly greater incidence of COVID-19 related death. Specifically, through March, unvaccinated people at least 5 years of age or older had 10 times the risk of dying from COVID-19 compared with those who were vaccinated with at least the primary series. And I do want to say I didn't layer booster doses on top of it, but I will mention later in this presentation that actually the most powerful thing you can do is be vaccinated with the primary series and boosted such that you become up to date with your COVID-19 vaccines. Don't worry, we'll get into what those definitions are. Now I want to start transitioning to what our experience with COVID-19 vaccines has been in the United States. In other words, when we at the Centers for Disease Control and Prevention say COVID-19 vaccines are safe and effective, how do we know that? By what experience are we judging their safety and efficacy? So I just wanted to open with this slide to communicate with you all that millions of people in the United States have received a COVID-19 vaccine. So just as of June 17th, you'll see that we as a nation have distributed over 750 million vaccines. We've administered almost 600 million vaccine doses. There are just over 220 million people in the United States of America fully vaccinated today, over 100 million with at least one booster dose, almost 17 million with a second booster dose. Now, not everyone is eligible yet for a second booster dose, but already almost 17 million folks have that second booster dose. And you can see that actually this comprises a good chunk of the population. If you look on your right, for people over 5 years of age, 83% of those folks in the US have received at least one dose of the vaccine, going all the way up to those over 65 years of age. More than 95% of people have received at least one dose. And I do want to provide one caveat here, which is that our metrics in this data system are capped at 95% coverage by study protocol. And so we actually suspect it to be higher than this, but in this data set, and that is COVIDNet, you'll see that we don't get higher than that. So we've gotten a substantial portion of our US population vaccinated. And so from that, with over hundreds of millions of doses, we can speak to safety and efficacy. And then what kinds of vaccines have we used? This shows you a breakdown by type, and this is through June 17th, 2022, over the course of the entire pandemic since vaccines became available. We've administered just under 350 million doses of Pfizer, just over 220 million doses of Moderna, and about 18 to 19 million doses of J&J, otherwise known as the Janssen vaccine. There are this little tiny group of other vaccines, and I'll just speak briefly to that to say this includes vaccines that are approved under emergency use listing through the World Health Organization, and we're mostly not done on US soil, but just to say we have a little bit of experience elsewhere. Okay, so from all that, from both hundreds of millions of doses, from the majority of population of each age group over the age of 5, thus far vaccinated with at least one dose, we as CDC and many of our partners say that these vaccines are safe and effective. What do we mean by that? So first, let's talk about how we know that COVID-19 vaccines are safe. So first, we want to say COVID-19 vaccines were developed originally using science that has been around for decades. Some of these vaccines are new, but they were built on the back of decades old science. Secondly, we know that COVID-19 vaccines are safe, much safer than getting COVID-19. We know that COVID-19 vaccines are effective at preventing severe illness from COVID-19 and also limiting the spread of the virus that causes it. Millions of people have received vaccines under the most intense safety monitoring in US history. And because of all this, we as CDC do recommend you get a COVID-19 vaccine as soon as you can. And I'll speak further in a moment that we recommend that you stay up to date with your COVID-19 vaccines. But first, I wanted to take a second to talk about these arms of safety surveillance that we have constantly ongoing, comprising this most intense safety monitoring in United States history. So VAERS, otherwise known as the Vaccine Adverse Event Reporting System, is affectionately known as our nation's early warning system for vaccine safety. We have a ton of lessons learned through the many reports that are made through VAERS that help us evaluate any side effects the vaccine might have, any safety issues that may have occurred, to identify any signals. So VAERS accepts reports from everyone. By that, we mean everyone: healthcare professionals, patients, parents of patients, caregivers of patients, manufacturers of vaccine, all of the above, regardless of the plausibility of the vaccine having caused an event, and regardless of the clinical seriousness of an event. So if there is something that either a healthcare professional or a patient or a parent or a caregiver or a manufacturer or anyone believes might have occurred as a result of a vaccine, we want to hear about it, and we do hear about it through VAERS. Through VAERS, we rapidly detect potential safety problems, and we can detect even very rare adverse events because of the size and the reach of this surveillance system. Some of the limits are that it's a passive surveillance system, that we get really inconsistent quality and completeness of information. In a moment, I'm going to talk about how we handle that. There are reporting biases. We see some professionals report far more than others. We see some populations report far more than others. So we just have to be aware of that. And generally, we can't determine cause and effect, but we have a very powerful system of detection of any problems here. And as I go through these other systems, you might see how we arrive at overcoming the key limitations inherent to this system. So let's talk about some of the other systems here. So we also have a smartphone-based active safety monitoring system. This is called vSafe. I hope that some of you listening on this Facebook Live event have some experience with vSafe. We at CDC work very hard to promote this everywhere that vaccines are given. This vaccine safety system, otherwise known as vSafe, allows you to enroll yourself or your dependent after any dose of vaccine for active monitoring after that vaccine. So in other words, you do as an individual or as the parent or provider for, not provider, parent or caregiver for a patient that got a vaccine, you do need to opt in. This is voluntary. No one's going to require you to do this. But once you do, you give us the ability to reach out to you at given intervals and check in to see how things are going. In other words, this allows us to establish a very active safety surveillance arm on top of the passive surveillance arm that you see in terms of VAERS, which requires us to wait for reports to come in. In this system, we'll come to you and ask you how you are feeling, and ask you what you're experiencing, whether there's any possible report in there or not. We want to hear from you. I mentioned at the start of this talk, there were 2 times I was going to say, we would love your help. This is one of those times. When you or your child or a person that you provide care for get a vaccine, please, if you would be so kind, consider enrolling in vSafe after your vaccination. This will help only further strengthen our vaccine surveillance, particularly this active side of our vaccine surveillance. And I'll say we've just recently established recommendations for vaccines in patients ages 6 months through 4 years. And we really want parents of those kiddos to enroll in vSafe when they get those vaccinations. Okay, next. This is a really neat system called Vaccine Safety Datalink. This was established, oh gosh, turns out more than 30 years ago. I'm always tempted to say recently in 1990. Okay, not so recently. We have a very strong relationship with these 9 very large integrated healthcare organizations through which we can learn what healthcare organizations are learning and seeing, what they're identifying, what they're hearing, what they're experiencing after vaccination. So this allows us to pick up things not from a catch-all reporting passive system like VAERS, not from an individual active system like we have with individuals through vSafe, but rather this is a completely new angle. This is surveillance through these closely built relationships with giant healthcare organizations. So this is sort of our view through the healthcare lens. And so this is a very valuable addition to our ongoing intensive vaccine safety surveillance. And then lastly, we have CISA, the Clinical Immunization Safety Assessment Project. This, through 7 participating medical research centers with vaccine safety experts, allows us to offer clinical consult services and clinical research. So this allows us to look quite actively at reports we've received, follow up on any potential safety signals, and go after those safety signals with tailored research to target that safety signal and understanding what might be behind that. So, I mentioned back a few slides that we can't determine cause and effect. Well, after we undertake specific research, after we do some of these intensive consults, occasionally that gives us the amount of information that we would need to start moving towards understanding those rare times that a vaccine has caused some kind of a safety threat, or more commonly, has caused a side effect. Now, having discussed safety at length, I just want to take a second to say that COVID-19 vaccines are effective. Being up to date on COVID-19 vaccines continues to provide strong protection against severe disease, hospitalization, and death in both adults and children, and including during Omicron variant predominance. And I want to just give you an example. I know this is a really busy slide. I just walked through for you in the vein of safety, the 4 major arms that we have monitoring vaccine safety surveillance. In vaccine effectiveness, we go to far more than 4. There are multiple platforms currently studying vaccine effectiveness located across the US. And so just to provide an example of what kind of data we get, we are constantly collecting from them all kinds of information about how much efficacy we see against. So this example is hospitalization in various populations. You'll see vaccine effectiveness estimates in the second column. And then in what age groups, you'll see age groups in the third column. Using what vaccines, you'll see vaccines in the fourth column. Over what population, what amount of the US, which states or jurisdictions, over what time, that's the study period that you see in the next column, what platform was used to arrive at this, and then where can you find complete publications to this end. So we are constantly weighing various types of vaccine effectiveness against infection, against illness, against medical visits of an outpatient nature, against hospitalization, against intubation, against death. Those are some of the major categories that we're constantly monitoring. And I would say, just to sort of provide a large summary, you may have heard some people saying that, oh gosh, the vaccines are getting less effective. And I would say we have seen the efficacy against asymptomatic infection wane. We have seen that in this era of the Omicron variant, which is incredibly infectious, we have seen that the effectiveness of the vaccine at preventing infection per se has waned. That is less and less true the more severe an outcome you're talking about. So it's less true at symptomatic illness. It's much less true once you get to medical visits. And then to go back to the previous slide, we remain extremely confident that the vaccines continue to provide very strong protection against severe disease, hospitalization, and death across all ages and all vaccine product types. So now, I just went back and said CDC recommends you stay up to date with your vaccines. Well, what does that mean? This term emerged in December of 2021, and so I wanted to explain it a little more. You are up to date with your COVID-19 vaccines when you've received all doses in the primary series and all boosters recommended for you when eligible. So let's talk a little bit more about what that means in terms of details. So right now, CDC recommends the COVID-19 primary series vaccines for everyone ages 6 months and older. That's newest in those ages 6 months through 4 years. That's as of Saturday, and recommends COVID-19 boosters for everyone ages 5 and older if eligible. In other words, if enough time has passed from the time that they completed their primary series. Now, people with moderate or severe immunocompromise have specific recommendations for COVID-19, including boosters. And so I've included a link here for COVID-19 vaccine recommendations for those who are moderately or severely immunocompromised. And just to expound on that a little bit, Spina Bifida in and of itself is not a form of moderate or severe immunocompromise or immunocompromise at all. But we do know that some people with Spina Bifida do have moderate or severe immunocompromise. So some of these definitely might apply if you are watching this webinar or caring for someone with Spina Bifida. We have a tool that you can use that's publicly available to learn when you can get boosters to stay up to date with your COVID-19 vaccines. And this last bullet is just to say that we're going to continue updating our vaccine and booster recommendations whenever we have new information available. Our most recent update was made on June 19th. That was Sunday. That was the day after June 18th, which was the last date of an emergency COVID-19 vaccine ACIP meeting, meaning Advisory Committee on Immunization Practices, that we held because we were aware of new data pertaining to COVID-19 vaccines from Pfizer and Moderna for children ages 6 months through 4 years for Pfizer and ages 6 months through 5 years for Moderna, that was presented to FDA. FDA offered emergency use authorizations for both those products on the 16th of June of 2022. And so we met on the 18th and the 17th and 18th, and then got all these new recommendations up on the 19th. The reason I'm underscoring how recent this was is if you follow our vaccine pages, you'll see that we update data very often. We update recommendations very often because vaccines are our single best public health measure to protect our communities and to ultimately defeat this pandemic. We are updating according to the most recent available data all the time, and will continue to do so. Okay, now that we've walked through our experience with COVID-19, our experience with vaccines, now that we've walked through why we're able to say they're safe, why we're able to say they're effective, what kind of efficacy we see most strongly now, we've walked through that CDC recommends everyone stay up to date. At this point, I thought I would take a moment just to walk through what the vaccination schedule is for most people, and then I'm going to do a whole separate run for those with moderate or severe immunocompromise. You can find these guides on our website. I know it gets a little small when we try to smush them onto a slide, but you can find these PDFs on our website at the link that's included below. So for folks that are real young, so our youngest kiddos, ages 6 months through 4 years, are eligible for either Pfizer or Moderna. Moderna eligibility extends up through 5 years. Those folks each have a primary series. Now for Moderna, that's a 2-dose primary series. For Pfizer, that's a 3-dose primary series. And then at age 5, if you're pursuing Moderna, you've got that 2-dose primary series. If you're pursuing Pfizer, you've got a 2-dose primary series. And then everyone ages 5 and older is now eligible for a booster. So that's dose 3. And then because you'll see on this line, Pfizer ages 5 and older up to and including those ages 50 years and older, those folks are recommended for a second booster. So that would be a 4th dose. And then just to touch on Moderna again, Moderna is also authorized for use in those ages 18 years and older. And that is a 2-dose primary series, a booster 5 months after that. And then those ages 50 and older, again, should get a 4th dose or a second booster. And then Janssen is a 1-dose primary series with a booster recommended 2 months later. And then those ages 50 years and older should get a second booster, but that should be with an mRNA vaccine. So that would be Pfizer or Moderna. And those who are ages 18 years and older who receive 2 Janssen doses, meaning both for primary series and booster, may also elect to get a second booster. And again, that would be with an mRNA vaccine. I will pause here to say that we don't recommend Janssen vaccine except in some specific circumstances. So if someone has a contraindication for one of these mRNA vaccines like Pfizer or Moderna, or despite the small safety risk in Janssen vaccine, and that risk is of blood clots. If they still want to get it, we would say as long as they have a good understanding of benefits and risks, that would be okay. But we are recommending Moderna and Pfizer vaccines, given the wealth of safety and efficacy data that we have based on them. Now let's move to recommendations for those with moderate or severe immunocompromise. What you'll see here is the following changes. For Moderna in the youngest kids, you've got a 3rd dose. Interestingly, for Pfizer in the youngest kids, those ages 6 months through 4 years, it's still just a 3-dose primary series. And then for all other groups of people, those ages 5 and above, you have a 2-dose primary series. You have a 3rd primary series dose for those ages 6 months to 5 years. And for all other groups, you've got a 4th dose that is a booster. And then if you're ages 18 years or older, a 5th dose, which is a second booster. And that's because the primary series ends up being 3 effectively for those with moderate or severe immunocompromise. I want to pause for a second and reflect that this is a lot of information. This is the first time you're hearing this. So don't be alarmed if you're not tracking exactly who needs what doses. I'll just say 2 things. These guides are all available to you by going to cdc.gov or just clicking on this link, and I'll share these slides after. And your physician and your local vaccine clinic can also answer these questions for you. Okay, and then I'm going to go to just some resources for vaccine recipients that we're just making available because they tend to help those who we hope to help get vaccinated. There's a special emphasis here lately in our resources on vaccines for kids because those are increasingly available, but you can find all kinds of resources available here, and I hope that you enjoy looking through these. Now we've come to the last thing I'm going to ask for your help with. If you are on this call and watching, you, my friend, have some social media savvy. And if you have some social media savvy, you who are watching this on Facebook Live, you know the threats that public health has encountered recently due to misinformation circulating on social media. And so I just wanted to put a plug here for some ways that you can help counter misinformation. There are a bunch of links here all of which will lead you to credible, cleared, and clear information on what COVID is and is doing to our population, and what these vaccines are, how safe and effective they are, and their power in countering COVID-19 disease, not just on our own behalf, but on behalf of those that we love. So with that said, I'm going to stop and see if anyone has any questions. Thanks so much.
Wow, I'm just like, I need to give you some snaps. That was incredible. Thank you so much. I myself have learned, I just learned so much more than I ever thought I knew about COVID and the vaccine. So thank you. And I'm sure everyone here that's watching is very appreciative. So thank you so much for sharing all that. It was a great rundown. And yeah, I think we do have a couple questions. Let's see. We have a lot of thank yous. We have great information and a lot of appreciation for what you shared. So, and I think you may have touched on this, but with the new announcement that the vaccines are now safe for children 6 months and up, does that include children with spina bifida as well?
It does. It does not exclude any children between the ages of 6 months and 5 years for Moderna, or 6 months and 4 years for Pfizer. The only contraindication for those kiddos would be if they were in the incredibly small group who had a known anaphylactic allergy to one of the components of an mRNA vaccine. And so if you think your child might be in one of those groups, please rest assured first that those groups are very small, but you can speak with your allergist. You can go to our interim clinical considerations website, where we have a complete list of all ingredients in every, not just vaccine, but anything like normal saline that they might be diluted with. And so you can rest assured that you can get that complete list and know for sure that you can have confidence.
Okay.
And I will just add to that we already know that none of the vaccines that come delivered use latex in any way, shape, or form.
Oh, good.
So, so from a latex sensitivity / latex allergy or precaution standpoint, none of the vials, none of the stoppers, none of those things contain latex.
Okay, that's so good to know. And Tim, you yourself, you have spina bifida as an adult, and you've been vaccinated, correct?
I have.
Yeah. How did you decide to go ahead and get it?
So first of all, understand that I'm a physician, and I work with kids with disabilities. We know that people with disabilities in general may be at a slightly higher risk of getting COVID-19. We don't know exactly why that is. It may be that they have underlying respiratory problems, which place them at increased risk of more severe disease. It doesn't seem that they're more likely to inherently get COVID, but they may have secondary conditions that place them at more increased risk of disease. That might be underlying breathing issues. It could be in spina bifida and earlier incidents for a variety of reasons, of obesity or type 2 diabetes or other kinds of things that we know were already risk factors. But kids with disabilities may be at increased risk. And one of the things that I did as a healthcare provider when I got my MD degree was to give an oath that in my career, I would do what I could to improve the lives of people with disease and do no harm in trying to make sure that they're getting what they need. And I will tell you personally that there were for me personally, the experience of people has varied. My 90-year-old mother got all of the COVID vaccines and her boosters and never experienced a side effect. I experienced kind of significant fatigue and a few muscle aches, no fevers, nothing else. And literally that lasted about 24 hours and I was back to myself.
Mhm.
So I personally have not been reluctant to get any vaccines. I will also tell you that some of that is colored by the fact that I'm old enough that, we went through major public health issues related to polio and diphtheria and other kinds of diseases where once vaccines came out, those diseases significantly improved, and we weren't getting deaths from those. I remember still going for shots related to those when my parents, when those came out and my parents took me. So I'm a big believer in the value of all vaccines, and certainly I'm a believer in the value of the COVID vaccine.
Absolutely. Thank you so much. I love that reasoning and all that information. Thank you. We had a couple questions about if this session is being recorded and if folks will be able to watch it later. Absolutely. I made sure to hit record. We'll be putting it on our Facebook and Instagram, hopefully by tomorrow. So you'll be able to watch it and get answers to all those questions. Another one we have is, so Evelyn, you talked about the statistics of the percentages of how many people are vaccinated. It's 95 plus for those who are, was it 65 and up? Which is incredible. And even below that, the percentages are much higher than I thought they were. So are we getting close to herd immunity?
That is a great question, Jessica. Thank you so much for asking. I'm going to try to say this in a way that everyone can come with me, because this is a really important concept and it's a little bit hard to convey. So let me try and then see what follow-up questions there are after it.
Okay.
The problem with the concept of herd immunity in the context of a rapidly changing virus is that learned immunity to one virus might not last through all of that virus's subsequent variants.
Mm-hmm.
Because of that, what we are learning, and I'll say just very honestly, we're discouraged to be learning this, but what we are learning is that herd immunity is not a very helpful concept at this time. It's not very helpful for where we are in this pandemic. And given what we have seen this virus do, it has developed something called antigenic distance from its predecessors. So that is just a long word, long way of saying it has already become substantially different from its predecessors.
Mm-hmm.
So that is to say, when this when we first recognized this virus, it was a variant that we like to call the ancestral variant, meaning sort of the ancestor, the original variant that started this whole thing. And then we went through alpha, then we went through beta, then we went through iota and gamma approximately simultaneously. Then we saw delta, and that was a significant change in variant, as it was of remarkable morbidity and mortality. So the virus became what we call more virulent at that time. In other words, causing more morbidity and mortality. And then, much to all of our amazement, I wish you could have been in the response room with us as we watched the variant tracker. Omicron just developed this degree of infectiousness that almost annihilated every other variant. And it did that by moving faster than previous variants, right? So it got to new patients, as it were, new people, faster than other variants could get to them, and thereby wiped out the other variants. I say this to say, just because we don't know that we're ever going to arrive at herd immunity anytime soon, just because we don't think that that is any longer a very helpful construct in the speed at which this virus is mutating, doesn't mean we don't have anything. We have vaccines that are safe and effective. We have all kinds of studies of what immunity looks like after infection, what it looks like after vaccination, what it looks like after the combination of vaccination and infection. And we know that the safest way to protect your health and the health of your family and your community is to get vaccinated. Yes, even if you've had COVID-19 in the past, because I tell you the truth, the virus is changing and it is changing fast. And we know that if people get vaccinated, they've got better protection than those who had a illness with COVID-19 and then did not get vaccinated. And so I just encourage everyone on this call to get vaccinated, stay up to date with your vaccinations, encourage your friends and family to get vaccinated, and help us counter all the misinformation on social media.
All right. That is a perfect answer. So thank you so much for that.
Hey,
Let's see.
can I chime in a little bit?
Absolutely.
Well, so I also look at this in the context of the bigger picture of people with spina bifida. So one of the challenges that we saw with Delta and with Omicron is that people with the virus who had, if they had been vaccinated, may not have needed to be hospitalized. Those situations placed healthcare systems at risk, so that perhaps a surgery in your child had to be delayed. Perhaps other treatment had to be delayed. Perhaps somebody with a heart attack in your family couldn't have access to the right care because there was no reserve in the healthcare system. And so I think one of the things is that while it may not prevent you getting the virus to be vaccinated, I think it does help that to some degree, but it's not the immunity I think we all hoped for. Mm-hmm. But certainly doing something so that you don't get severe disease, and that other things that you may need related to your health can actually happen in a timely fashion, I think is also really important to consider.
Absolutely. Absolutely. Thank you, Tim. We have a question from someone who they're 40 years old. They got their first booster back in November 2021, and they want to know, when should they get their second booster?
Okay, thank you. So if you as a 40-year-old person are not affected by moderate or severe immunocompromise, and you had an mRNA vaccine, that is to say either Pfizer or Moderna, and you weren't talking about just getting Janssen, or otherwise known as the J&J vaccine, then you're not currently eligible for a second booster, but do stay tuned. I can just provide a preview of what is upcoming. We are starting to look very closely at vaccines that target some specific variants of SARS-CoV-2, the virus that causes COVID-19. And we are eager to see if some of those vaccines might have a strong evidence behind them, say come fall. You know, I'm not going to predict anything with certainty, but we are really excited about some of the things that we're looking at, and hopeful that some of the clinical trials, which we know are going well, will pan out to additional protection for people like you.
Okay. So we will stay tuned. We are coming up close to our hour, so I did want to just end with one last question to each of you, and that is, if somebody has spina bifida, they are not vaccinated yet, they're on the fence, what advice would you have for them?
So as a person with spina bifida, separate from being a physician, I would definitely get vaccinated. We know that vaccines may run the risk of some side effects. The majority of those side effects are very temporary. Some of them have been more serious, and you can certainly go to the CDC website and look at the more significant side effects that have been reported. But I think it's the best thing you can do for your health in this time of the COVID vaccine and the COVID pandemic. The risks of getting COVID, I've had patients who did die from COVID. And for something where the safety of the vaccine is known, the monitoring of safety is so vast. I think one of the best things you can do for your health right now is to be vaccinated.
Okay, thank you. Evelyn, what would you recommend?
I'll add to that. I'll reflect on some of my own personal history as well. I have also unfortunately lost patients to COVID-19 disease. I have lost family members to COVID-19 disease. I mentioned at the very beginning that my best friend in grade school, her name was Nola, and she had spina bifida, and she is no longer with us, and she did not live in the era of COVID-19. But if you asked me, would I do anything to give her a better chance at survival? Would I have done anything at the time? Would I do anything today? Absolutely. Would I do anything today to give people with spina bifida today a better chance at the full life that everyone with spina bifida deserves? Absolutely, I would. And we know that the single best measure we have to protect ourselves as individuals and to protect our community from COVID-19 disease and death is the COVID-19 vaccine. So I would strongly encourage everyone to get it. And these are not just words. I myself have been vaccinated and boosted. My 7-year-old is vaccinated and boosted. My 4-year-old, hip hip hooray, has a vaccine appointment tomorrow, given that he has just become eligible. And so I strongly encourage everyone on this call to do that for themselves and to encourage their friends and family to do the same. Thank you so much.
Right. Thank you. Thank you both so much for joining us today. We had a lot of great feedback, a lot of great comments. So we are recording this. We'll have it live up on our Instagram and our Facebook for everyone to watch at their convenience. So thank you guys so much. Enjoy the rest of your day.
Thank you so much.
Bye. Thank you.
Stay safe, stay well.
Yes. Bye.
Thank you.